Hello, everyone. Today we are going to talk about pharmacology, which is one of the most feared topics by most nurses in the nursing schools and English candidates. So we are going to talk about calcium channel blockers, which are commonly called CCBs. So what are these drugs? So these drugs, their mode of action is simply related to their name. They block the entry of calcium into the heart and the smooth muscles. That's the mode of action. So it is very important when you are doing pharmacology to understand drugs not individually but to group them in their class. So which drugs are we talking about? So once you hear about drugs that end with dipine, you just know that these are calcium channel blockers. So the drugs that end with the dipine, for example, we have drugs like nifedipine, nisodipine, nicardipine, and the like. So they end up with dipine. Also, these drugs, we have drugs that end up with the ZEM. Okay, it's another ending of the drugs, calcium channel blockers. We have drugs like diltiazem. It's a calcium channel blocker. There's only one drug that you have to know, which is verapamil. Okay, so all the drugs that end with the dipine, all the drugs that end with the zem, and we have verapamil. These are the calcium channel blockers. Okay, so what do they do? What are the effects when you give these drugs to the patients? What are the effects? These drugs, what they are going to do is they are going to decrease the heart rate because they calm the heart muscles. They reduces the tone of the heart muscles. So they are going to decrease the heart rate. They are going to decrease contractility. They're also going to decrease the blood pressure and they increase vasodilation. So these are the effects of all calcium channel blockers uh, on your heart and your blood vessels. Okay. So what are the indications? Which patients do we give these drugs with? Hypertension, angina, because these drugs they are going to reduce the oxygen demand of the heart, so they are used to treat angina, and they are also used to treat arrhythmias, especially the atria arrhythmias. Okay. So when we are giving these drugs, what are the side effects? So for you to understand the side effects, you just need to memorize this mnemonic HHBPC. Once you memorize the HHBPC, you have memorized the side effects of all the calcium channel blockers. So this H stands for headache. These drugs they tend to cause headache. Okay, hypotension because they decrease they cause vasodilation, so they are going to cause hypotension. Bradycardia because they reduce the muscle contractility of the heart, they cause bradycardia. Then peripheral edema, they also cause peripheral edema. Then they also cause constipation, especially verapamil. This drug it causes constipation. So there are certain things that you need to watch out for, which are mostly asked in English exams. You have to, when you are giving these drugs, you have to watch out for heart block. Okay. You also need to watch out for heart failure. They tend to increase heart failure, so you don't need to give these drugs to people who have heart failure. Then one most important thing is to avoid grapefruit. When patients are taking calcium channel blockers, you don't need to give them grapefruit. Why are we not giving them grapefruit? Because um, this grapefruit it inhibits the enzyme CYP3A4. So this enzyme CYP3A4, it's the enzyme that causes the metabolism of most of the calcium channel blockers. So once it's inhibited by the grapefruit, what's going to happen is that there's going to be high concentration of these drugs into the in the blood vessels. Once there is high concentration of these drugs, there's going to be increase the risk for toxicity. So this aspect is one of the most important things that we need to understand, that we need to avoid grapefruit when a patient is taking calcium channel blockers. Okay, for us to understand more about pharmacology, follow this page and watch out for more.